Hello, my name is Catherine Carter, and I am the Infection Control Officer for this dental office and its fellow dental healthcare personnel. Today we will be completing annual training covering OSHA regulations and CDC recommendations for waste management and infection control as it pertains to the dental healthcare setting. Why are we doing annual training? We do annual training to provide education for new and existing dental healthcare personnel and ensures infection prevention principles and procedures are understood and followed. It provides principles and recommendations for infection control in dental healthcare settings. It reaffirms standard precautions as the foundation of preventing infection transmission. It develops and maintains infection prevention and occupational health programs, develops and maintains written infection prevention policies and procedures, provides an early detection system and management of potentially infected persons at initial points of patient encounter. All right, on this slide, we do have a lot of verbiage here. I just wanted to go ahead and get some definitions down. So I'm going to go ahead and read our OSHA regulations and the definition for what is the bloodborne pathogen standard. OSHA's bloodborne pathogen standard, as amended pursuant to the 2000 Needle Stick Safety and Prevention Act, is a regulation that provides safeguards to protect workers against health hazards related to bloodborne pathogens. It has provisions for exposure control plans, engineering and work practice controls, hepatitis B vaccinations, hazard communication and training, and record keeping. The standard imposes requirements on employers of workers who may be exposed to blood or other potentially infectious materials, such as certain tissues and bodily fluids. I do have the link below if you want a little bit more information. Bloodborne pathogens means pathogenic or microorganisms that are present in human blood and can cause diseases in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV. Link provided. Universal precautions is an approach to infection control to treat all human blood and certain human body fluids as if they were known to be infectious for HIV, HPV, and other bloodborne pathogens. The link is also provided. Also included in the bloodborne pathogen standard, it ensures employees have to provide Sharps injury log containers and prevention procedures and principles. It has a written and maintained exposure control plan to eliminate or reduce exposure, the use of universal precautions, the use of PPE, the hepatitis B vaccine at no cost to the employee, medical follow-up after any incident, color coding for Sharps regulated waste, contaminated laundry, and specimens, proper containment of regulated waste, and proper employee training. Next, we'll be going over CDC recommendations regarding standard precautions. First on the list is hand hygiene. We perform hand hygiene when our hands are visibly soiled, when we have bare hand touched of instruments, materials, or other objects that are potentially contaminated, before and after glove donning, before and after each patient, and an alcohol-based hand rub may be used. This is not the first point. The alcohol-based hand wash or hand rub should not be in replace for soiled hands. You need to use soap and water. Right. The CDC recommendations for standard precautions, I'd like to go back and just say here that the link that I have here are the key recommendations for hand hygiene. They are located on page 7. If you'd like any more explanation, I have that on each slide. The CDC recommendations, standard precautions for personal protective equipment, page 8 on the link provided. Employer must provide sufficient and appropriate personal protective equipment for all personnel. Employer must educate all dental healthcare personnel on proper personal protective equipment selection. You must wear gloves whenever a potential contact of blood, body fluids, mucous membrane, skin, or contaminated equipment. Do not wear the same gloves more than once or between patients. Do not wash gloves. Perform hand hygiene immediately after removal of gloves. In addition, we must wear protective clothing that covers skin and personal clothing during procedures or activities where contact with blood, saliva is anticipated. Wear mouth, nose, and eye protection during procedures likely to splash or splatter bloody or bodily fluids. Remove PPE before leaving work area. I'd like to go over the picture that we have here regarding the PPE on the, do I have my cursor? Here we go. This is the biohazard bag where you would place any bloody contaminated items. This looks like full headgear. I'm not sure. I don't think we would necessarily have to wear that, but we'll see. This is your face shield, your face mask. Those look like utility gloves. Those look like general latex or exam gloves. Okay, slide. Okay, CDC recommendations for your standard precautions regarding your respiratory cough etiquette. These are the key recommendations on page 9, the link provided. The picture that we have here is the cover your cough sign, which is recommended by the CDC to post signs at entrances with instructions to patient with symptoms of respiratory infections to cover their mouths, noses when they cough or sneeze, use and dispose of tissues, perform hand hygiene after a cough or a sneeze. Provide tissues and no-touch receptacles. This is the facility must provide tissues and no-touch receptacles, and the facility must provide resources for proper hand hygiene in waiting areas. Go back, we got a few. All right. Facility must offer masks to coughing patients. They must provide space and encourage affected persons to sit as far away as possible from another patient or preferably in a separate waiting area. Employer must educate dental healthcare personnel on the importance of infection prevention measures to contain respiratory secretions to prevent the spread of respiratory infections while examining and caring for the patient with signs or symptoms of respiratory infection. Again, this is an example of the sign that you would have up. Patients. Okay, now CDC recommendations for sharps safety. The key recommendations are on page 10 of the link provided. All right. A needle, scaler, burrs, lab knives, and wires are all considered sharps and should be considered as such. They are disposed of and consider sharps such as needles, scalers, burrs, lab knives, and wires that are contaminated with patient blood and saliva as potentially infective and establish engineering controls and work practices. Do not recap needles by using two hands. Use one-handed scoop technique or mechanical device for holding needle cap. Place used disposable sharps in appropriate puncture-resistant container located as close as possible to the area where the items are used. This right here, we have our picture. Be smart with sharps. Avoid injury while discarding your sharps. Just be aware that needle stick can expose you to infectious diseases such as hepatitis and HIV. Safe injection practices. The key recommendations are on page 11 of the link provided. We'll go over a few. First, you will prepare the injection site with aseptic technique in a clean working area. You will disinfect the rubber receptacle of the medication with alcohol before piercing with the needle. Do not reuse needles, syringes for multiple patients or on multiple times. Medication containers are only entered with new needle and syringe. Single-use medication vials, ampules, bags, and bottles are not to be used for more than one patient. You do not combine leftover medications. Restrictions for multi-dose vials are explained in the link provided. And do not use fluid infusions or administration for more than one patient. Basically, and this poster says it all, one needle, one syringe, only one time. The same needle, same syringe should not be touching the patient twice. It should not be touching a vial twice. It needs to be disposed of immediately after one single use. All right. CDC recommendations and standard precautions for sterile instruments and devices. The key recommendations are on page 14 for detailed, and I'll be going, for the link provided, I'll be going over the key recommendations. Clean and reprocess reusable dental equipment appropriately before use on any patient. Clean and reprocess reusable dental equipment according to manufacturer instructions. Assign responsibilities to the dental healthcare personnel with the appropriate training. I feel like that needs to be in bold. Wear personal protective equipment while handling and reprocessing patient equipment. Remember standard precautions. Remember. Use mechanical, chemical, and biological monitors according to manufacturer instructions to ensure the effectiveness of sterilization process. Maintain records in accordance to your state and local regulations. Now, our picture here, we have bagged dental equipment, sterile. All right, the CDC recommendations for cleaning and disinfected environmental services, key recommendations on page 15 of the link provided. Right. First, the dental office must establish policy and procedures for routine cleaning and disinfection of environmental services. Select EPA registered. EPA is Environmental Protection Agency. EPA registered disinfectants with label claims for use in healthcare settings. Follow manufacturer's instructions for use of cleaners and EPA registered disinfectants. CDC recommendations for standard precautions for the dental unit water quality. Key recommendations, page 16 on the link provided. Use water that meets EPA regulation standards for drinking water. Consult with dental unit manufacturers for appropriate methods and equipment to maintain quality of dental water. Follow recommendations for monitoring water quality and use sterile saline water as an irrigant during surgical procedures. I'm going to go ahead and stop here. because the recording will stop in 3,